Treatment of precocious puberty. M. Hashimipur MD. Pediatric endocrinologist. Isfahan University of Medical Sciences. A 10-year-old girl referred to clinic with complaint of precocious puberty. A 10-year-old girl referred to clinic with complaint of precocious puberty. No significant finding in history taking. NPE breast is in tan or stage 2. No menstruation is occurred. Height, 145 centimeters. 1. What is your suggestion to do as paraclinical WU? 2. What do you recommend to her family? A 12-year-old boy came to clinic for evaluation of puberty. A 12-year-old boy came to clinic for evaluation of puberty. NPE testes are in tan or stage 3. Pubic hair in stage 1. No other significant finding. Height, 140 centimeters. 1. What do you recommend about the puberty of this patient? 2. Is there any need to treat this patient? Growth velocity. Growth during puberty, boys mean of 20 to 28 centimeters. Girls mean of 20 to 25 centimeters. Do you recommend to start any treatment to stop puberty? An 11.5-year-old girl referred to the clinic due to the first episode of menstruation. Breast is in tan or stage of 4. Height, 142 centimeters. Do you recommend to start any treatment to stop puberty? Growth after menarche, 1 to 7 centimeters. What is the prediction of final height? A 10-year-old female brought her clinic to delaying her menstruation for improvement of height. Breast is in tan or stage 2. Height is 122 centimeters. What is the prediction of final height? Do you prescribe GnRH agonists to this girl? Only pubic hair, without testicular or phallic enlargement. DDX. Premature adrenarche. Late onset type 21 deficit. 1. What is your diagnosis? 2. What kind of WU is needed? A 2-year-old girl referred to your office with chief complaint of puberty. NPE she has breast enlargement, stage 2 tenor. Height is 87 centimeters. No other positive findings are detected. 1. What is your diagnosis? 2. What kind of WU is needed? What do you do as paraclinical WU? A 5-year-old girl referred to your due to questionable history of vaginal bleeding. Her mother says that she has had several episodes of spotting during last 3 days. Breast is in tan or stage 1. What is the DDX? What do you do as paraclinical WU? Isolate a vaginal bleeding in the absence of other secondary sexual characters. Foreign body. Sexual abuse. Urethral prolapse. Vulvovaginitis. Treatment. Girls with onset of progressive CPP before 6 years of age benefit most in terms of height from treatment. Treatment. The decision to initiate therapy in girls with onset after the age of 6 should be individualized. Treatment should be considered for all boys with onset of progressive CPP before 9 years of age who have compromised height potential. Girls with onset of puberty in 6 to 8 years of age with slowly progressive puberty. And/or acceptable predicted adult height based on bone age has not been proven to have a significant effect in improving adult height. Treatment. If precocious puberty is slowly progressive, it is unlikely to compromise adult height potential. Treatment if the height prediction is above 150 cm girls, 160 cm boys. Therapy is probably not needed. Conservative approach is warranted. Criteria for immediate treatment of CPP. Complete clinical precocious puberty with pubertal LH levels after GnRH stimulation test. And chronological age less than 7 years in girls and less than 8 years in boys. Bone age advanced more than 2 SD beyond chronological age. In girls when puberty begins before the age of 7 years and is progressive, the decision to treat is mandatory to preserve height potential. It remains debatable whether girls with borderline early onset of puberty, 7 to 8 years, have a high risk of significantly short stature in adulthood if not treated. GnRH agonist treatment may be suggested for use only in girls who have psychological difficulties in coping with early and fast puberty. Criteria for immediate treatment of CPP. Predicted height either 2 10 cm, or more below genetic target height or less than 150 cm. Rapid deterioration of growth potential and rapid advancement of pubertal signs. Or severe psychological discomfort or behavioral reasons. Indications for follow-up and delay in treatment. Chronological age between 7 and 8 years in girls and between 8 and 9 years in boys. Bone age advance less than 2 beyond chronological age. Predicted height near target height or in the normal to high range. Slow progression of pubertal signs and echographic signs with maintenance of good growth potential. And absence of severe psychological discomfort or behavioral problems. Adverse effects of treatment. Transient vaginal withdrawal bleeding. Injection site reactions and arthralgia. Headache, nausea, hot flushes. Allergic reactions, headache, weight gain, increased blood pressure, episodes of blurred or abnormal vision, gastrointestinal tract discomfort with abdominal pain and vomiting, epistaxis, malaise, myalgia, emotional lability, nervousness. Initial ovarian stimulation at treatment initiation, followed by the treatment-induced estrogen withdrawal, may lead, in the first month, to vaginal bleeding of mild or moderate intensity. Follow-up during treatment. Height, weight, growth rate, and secondary sex characteristics. Bone maturation. Uterus and ovary size. Single blood sample for determination of LH and estradiol at 2 or 12 hours after injection of the depot GnRH agonist.